You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. By going to RolandMartinUnfiltered.com, you can make this possible.
All right, folks, we had mass shootings all across this country. I am here in Houston, of course. Two of those shootings took place in this state, in Texas, and El Paso. One of those places, again, people shot and killed. Of course, remember it was last year, not far from here in Santa Fe, where you also had a school mass shooting. And so how do we deal with that? Well, the reality is we're dealing with a public health crisis. Joining us right now from the National Medical Association is Roger Mitchell, who is the chairman of the NMA Gun Violence Task Force, and Oliver T. Brooks, president the National Medical Association. Oliver, I want to start with you. Doctors have been sounding the alarm, but unfortunately you have politicians like on the Republican side who still won't do jack when it comes to gun violence in this country because they are all about the National Rifle Association and their dollars.
That's absolutely true, and there is undue influence from the NRA. We at the National Medical Association, we are the conscience of medicine. We represent the 50,000 African-American physicians. We are here in Washington, D.C., convening our professional development series as part of the CBC, the Congressional Black Caucus. So as president, I determine what the objectives are for the NMA for the coming year. So I've looked at diversity in medicine, maternal mortality, but I will have to say my lead focus is gun violence or violence prevention, if you want to put it that way. There are more guns in the United States than there are people. Black people die at the hand of a gun 10 times the rate of the majority community. It is a public health issue. As physicians, when people are dying from something, that's what we look at. It's a public health issue. So we have an NMA gun violence, if you will, violence task force led by my gentleman on my right, Roger Mitchell. And here at the convention, we are looking at gun violence. We convened a panel today, and we have specific strategies that we are going to address to try to move the needle on gun violence.
Hey, Roger, look, one of the things that really jumps out is that when you talk to ER doctors, they talk about what they actually see, what they are witnessing and experiencing. And we're talking about a country where the NRA, led by Republicans, they would not even allow the CDC to actually even put together data on gun violence. That shows you this fear that exists when it comes to confronting gun violence in America.
Yeah, I mean, gun violence research is extremely important. The reality of it is that the Dickey Amendment, that's what you're talking about, that happened back in the mid-90s, that suggested that research that led to decreasing guns in this country should not be done by the Centers for Disease Control. The reality of it is that we know that seatbelts save lives in cars. We know that helmets save lives on motorcycles and bicycles. We know that there are particular controls on tobacco that need to occur in order to save lives from cancer and cardiovascular disease. And all of this was based upon research that was done by groups of physicians and public health providers and basic scientists. And that particular types of research was funded at some level by the federal government. And so when you don't have funding for gun violence, then there's a whole group of budding scientists and researchers that are not going to be able to do the work and get to the solutions. And so here at the National Medical Association, we're calling for full funding of the $50 million to the CDC and the NIH, $25 million apiece, particularly to look at equity issues surrounding gun violence, and universal background checks, and we're against bump stocks, all of the things that we believe that are going to protect our community.
Left or right? All right, then, gentlemen, Dr. Brooks, Dr. Mitchell, we certainly appreciate that and the work the National Medical Association is doing. Thanks a lot.
Well, yes, and one more thing, Roland, we would like to get back to you at some point in time on the devastation on the people of African descent in the Commonwealth of the Bahamas, another health crisis.
Okay. All right. We'll look forward to that. I appreciate it. Thanks a lot.
All right.
Thank you.
Thank you.
All right, I want to go to my panel here. Misha, I want to start with you. This idea that gun violence has reached the point of a public health crisis. If it was any other public health crisis, you would have folks marshaling the resources to combat this. That's not happening right now in America.
Absolutely. To name something a public health crisis initially means that there is going to be stronger funding sources for it, in particular because at that point it is recognized as something that is extremely detrimental and in many cases something that we have to fight against with multi-pronged strategies. And those strategies have to be community, they have to be at the federal level, they have to be a lot of things that are going to require access funding. One of the things that we see and the reason why this is not happening is because of the strength of the NRA and the strength of those on the right who believe that their gun rights are extremely hampered by moving forward and acknowledging this as the public health crisis it is. First and foremost, we didn't see people recognizing this when it's happening, and we still don't see them recognizing it when it happens in urban communities. And we rarely see it recognized as a public health crisis when we're talking about episodic attacks, when we're looking at places like El Paso, when we're looking at a lot of these instances where, at the end of the day, the reason why this is happening is because we have unmettered, in many cases, access to guns, and not just guns, but guns that have high capacity. That is a problem. And to hear anyone say that, you know, we need to protect our constitutional rights at the behest of somebody's life is a major issue.
Robert, this is real simple. This nation has a sickness when it comes to guns.
It's not that
sickness.
It's not that simple, though. We know that. Look, 3/4 of gun deaths per year.
Yes, it is.
3/4 of gun deaths are suicide in this country. So those people who are killing themselves with guns would have found another way to kill themselves because they wanted to kill themselves. On this issue of high capacity, look, on this issue of high capacity magazines, the average shootout, which takes a life, has about 3 shots fired. So the only time that we talk about gun control is when gun control was related to saving white people from other white people. That's what we're really discussing. We're not talking about urban violence. We're not talking about the person who buys a $50 gun and then commits a drug crime.
Are.
Well, look, this idea that background checks are assault rifle.
Rob,
Rob,
this is the problem right here. The fact of the matter is there is no developed nation in the world, no nation that comes close to the United States when it comes to the sickness of guns. Not one.
Not even close.
And we'd rather blame video games. We'd rather blame everything except the gun itself.
Correct.
And the access to them for this problem. And then, like, at this point, after Sandy Hook, a lot of people assume, self-included, that once these 3-year-old babies were lying slain, people would actually make that move. We would see Congress act, and we did not.
But the sickness is there, right? As you talked about, Roland, the sickness is there. It's part of the DNA of America. But look, this is what I predict, and I don't know when it's going to happen, but I'm going to tell my friend Robert, every other Republican that is holding on to this extreme point of view, it's easier to get access to a gun than it is to drive in this country. Think about that for a minute. It's easier to do that. But I actually predict that because they're so extreme, eventually they're going to see the rights pulled back. Because I think people are going to grow up getting sick and tired of having to go to elementary school and seeing their kids shot up, go walk in a movie theater and see somebody get shot up. You can't have a gun everywhere at every single moment. That's not going to work. And I think Americans and eventually a whole generation are going to get tired of living in fear. And this sickness that you said that we currently have has to be solved, because I don't think anybody should put up with this. I don't even understand why this is so complicated. New Zealand was able to solve it and go right there. As soon as that happened, they got to business. Right now, we're still having an argument about it. I really don't understand.
You literally have parents buying bulletproof backpacks for their kids.
Well, look, let's understand.
All right, Robert, final comment.
Final comment. The people who are committing these mass shootings, guess what? Japan has almost no guns. There's a mass stabbing where 19 school children got stabbed. Spain has almost no guns. Someone drove a truck through the middle of Barcelona. Nice, France, somebody drove a semi-trailer through a festival. People find a way to do evil.
And how? No. How often have you had mass stabbings in Japan? How often?
I think there were 3 in the last 3 years. And they also
Three in the last 3 years.
In the last 3 years.
I think we had a country a third of our size.
Hold on. I'm sorry. 3 in the last 3 years. I think we've had 3 in the last month.
We probably had 3 today.
Well, look, the issue is all the things that they're suggesting as solutions won't fix the problem. All the people commit mass shootings would have passed a background check. If they didn't have an assault rifle, they would have got 2 Glocks and done the same thing. You can get a thermite. You can get anything that you want.
If you can't do everything, do nothing. That's what he's saying. Do nothing.
What I'm saying is these laws will affect the law-abiding citizen.
Sickness. This nation has a sickness when it comes to guns. This nation has been built on violence, and it is in the DNA of this country, and somebody has to actually own it.
All right, folks, back to that Roland Martin Unfiltered video in just one moment. All right, folks, you heard me talk a lot about marijuanastock.org. Why? Because I want to keep you informed of investment opportunities that make sense. We've all watched the growth of the cannabis industry. A recent report by New Frontier Data estimates the global cannabis market at more than $340 billion. Of course, marijuana legalization is sweeping the country state by state. We know that marijuana has a good cousin, the hemp plant, with a much higher concentration of CBD. That means hemp gives you all the medical benefits of marijuana without getting you high. Until recently, hemp farming was practically illegal in the U.S. and heavily regulated by the DEA. However, the 2018 Farm Bill recently passed in Congress, making it legal to grow hemp CBD in the U.S. and creating one of the largest commodities worldwide. They need land to grow all of the plants. Folks, this is simple. It's an incredible investment opportunity. And that's where our good friends at 420 Real Estate come in. Their business model is simple. They buy land that supports hemp CBD grow operations and lease it to licensed, high-paying tenants. They are hemp CBD landlords, and you can get in on the action. Now, what they've done for the folks at Roland Martin Unfiltered is allow for you to make a minimum investment of $200. The initial investment was $500. You can invest this in the crowdfunding campaign. That's right, $200 up to $10,000. Now, again, all you got to do is go to marijuanastock.org. That's marijuanastock.org to get in the game, and get in the game now. Now back to your Roland Martin Unfiltered video.